first time in a very long time to get affordable health. That's it. That's what the Congress of the United States is about to vote on this weekend. Now, it would be nice if we were just kind of examining the substance. We were walking through the details of the plan, what it means for you, but that's not what the cable stations like to talk about. What they like to talk about is the politics of the vote. What does this mean in November? What does it mean to the poll numbers? Is this more of an advantage for Democrats or Republicans? What's it going to mean for Obama? Will his presidency be crippled?
No.
Or will he be the comeback kid? That's what they like to talk about. I understand. Yeah, one of the things you realize is basically that a lot of reporting in Washington, it's just like Sports Center. It's considered a sport. And who's up and who's down, and everybody's keeping score, and you got the teams going at it. It's rocking soccer robots. Look, let me say this, George Mason. I don't know how this plays politically. Nobody really does. I mean, there's been so much misinformation and so much confusion. You know, the climate at times during the course of this year has been so toxic, and people are so anxious because the economy has been going through such a tough time. I don't know what's going to happen with politics on this thing. I don't know whether my poll numbers go down, they go up. I don't know what happens in terms of Democrats versus Republicans. But here's what I do know. I do know that this bill, this legislation, is going to be enormously important for America's future. I do know the impact it will have on the millions of Americans who need our help, and the millions more who may not need help right now, but a year from now, or 5 years from now, or 10 years from now, if they have some bad luck, if heaven forbid they get sick, if they've got a pre-existing condition, if their child has a pre-existing condition, if they lose their job, if they want to start a company, I know the impact it will have on them. I know what this reform will mean for people like Leslie Banks, a single mom I met in Pennsylvania. She's trying to put her daughter through college, just like probably some of your moms and dads are trying to put you through college. And her insurance company just sent her a letter saying they plan to double her premium this year, have it go up 100%. And she can't afford it. So now she's trying to figure out, am I going to keep my insurance or am I going to keep my daughter in college? Leslie Banks needs us to pass this reform bill. She thought she had beaten her breast cancer. Then she discovered it spread to her lungs. She and her husband, they were lucky enough to have insurance, but their medical this more incremental? Why don't we do this a little more peaceful? Why don't we just help the folks that are easiest to help? My answer is, the time for reform is now. We have waited long enough. And in just a few days, a century-long struggle will culminate in historic moment. We've had historic votes before. We had a historic vote to put Social Security in place to make sure that our elderly did not live out their golden years in poverty. We had a historic vote in civil rights to make sure that everybody was equal under the law. As messy as this process is, as frustrating as this process is, as ugly as this process can be, when we have faced such decisions in our past, this nation, time and time again, has chosen to extend its promise to more of its people. You know, the naysayers said that Social Security would lead to socialism. But the men and women of Congress stood fast and created that program that lifted millions out of poverty. There were cynics that warned that Medicare would lead to a government takeover of our entire healthcare system. And that it didn't have much support in the polls, but Democrats and Republicans refused to back down, and they made sure that our seniors had the health care that they need, that they had some basic needs. So previous generations, those who came before us, made the decision that our seniors and our poor, through Medicaid, should not be forced to go without health care just because they couldn't afford it. Today it falls to this generation to decide whether we will make that same promise to hard-working middle-class families and small businesses all across America and to young Americans like yourselves who are just starting. So, here's my bottom line. I know this has been a difficult journey. I know this will be a tough vote. I know that everybody's counting votes right now in Washington. But I also remember a quote I saw on a plaque in the White House the other day, saying in the same room when I demanded answers from insurance executives and just received a bunch of excuses. And it was a quote from Teddy Roosevelt, the person who first called for health care reform, that Republican, all those years ago, and it said, aggressively fighting for the right